mentioned, our talk today is about using laughter to help us get through these stressful times. And my special guest today is Dr. Anil Maheshwari. That's easy for me to say. And our topic is laughter is good medicine. Anil is a primary care physician, family physician, and has practiced for over 21 years. He's practiced in Canada and the US and did his training in New Jersey. So he went to Rutgers for his undergrad. He did his medicine at New Jersey Medical School and did his 3-year family practice residency in New Jersey as well. He practices currently in Cambridge, Ontario, and he also practices with us at Cleveland Clinic Canada. We're delighted to have him. And he works in the executive health program as well as corporate medicine. He's an accomplished public speaker and also does stand-up comedy. I'm thrilled to have you today. I love stand-up comedy, and I think personally it's one of the most difficult areas in entertainment. Even when people crash, it is amazing it's an amazing form of entertainment. So welcome, Anil. And I understand through our conversations earlier that perhaps your father was not quite as thrilled that you were interested in comedy.
Yeah. Well, first of all, thank you for having me on and giving me a chance to get dressed up. I had to dust off the suit, but it gave me an opportunity to wear a suit. So thank you so much. Yeah. So it's been an interesting journey. I was always destined to be a doctor because my dad told me so. Whenever. He didn't understand why I would possibly want to have fun. Whenever he saw me laughing or giggling, he would say, "Anil, why are you always doing ha ha he he? I want you to study. I want you to become a doctor." And I would look up at him from my crib and start crying because he was yelling at me and my diaper was dirty. But yeah, he never understood the value of humor, but I did, and I had to because growing up when I did, there weren't many Indians in my school, and my teachers could not pronounce my name. So I quickly, I remember first day of gym class, the teacher was like, "Is there a anal here? Anal?" You can imagine as a child in school what that did to me. So I wasn't big enough to fight anybody, so I had to learn to use a sense of humor to get around that.
So anal. This is an interesting combination, medicine and comedy. When I asked you about how on earth you were able to combine the two, you told me a great story. So I went online and found these two slides that I thought you could use when I ask you to explain how you got into comedy. So take it away.
Right. So this is, I'm sure everybody recognizes the person on the left there. That's Adam Sandler, of course. And the little clipping from the newspaper is about the CERTS comedy competition. This was in my college years, or university years, as we say up in Canada. I was at Rutgers, and CERTS had this national comedy competition. If you won, you kept going higher and higher, and the winner got to perform in front of Jerry Seinfeld. And I had a friend who was Indian, and back then there were no Indian stand-up comics, and he was doing this, and I thought, you know how you are with your friends, you're very competitive. So I thought, well, if he can do it, I can do it. So I entered, and the MC at that event was someone that none of us knew by the name of Adam Sandler. He had just signed his Saturday Night Live contract, so he hadn't been on the air yet, so we didn't know him. He was quite funny, and as was my friend, and I managed to get my first laugh on stage, and really, let's be honest, it was my only laugh on stage that night, but it got me hooked to stand-up comedy.
That's a great story.
Yeah.
So we're in this pandemic, it's COVID-19.
We are?
And And how can we use humor during this time?
Yeah, so I think it's more important to use humor in a time like this than any other time. Stressful times raise our cortisol levels, make us very on edge. I'm sure everybody's noticed that you're probably on edge a little bit more than usual. I know I am. It's just a very difficult time, and we're not able to meet up with each other and connect and do the things that human beings really usually do. So we are using things like this platform, Zoom, FaceTime, and all these other platforms to get together with each other. But the good thing about humor is it travels well. And it is, I love this quote by Victor Borg, laughter is the shortest distance between two people. It really helps us to connect. Whether you're in person or you're online on Zoom, it helps us to connect. And so we must make an effort to keep our senses of humor. The other thing that laughter does is, as speaker June Klein says, laughter equals hope. And at a time like this, when all the news is talking about the statistics and how many people have died and how many people have gotten sick, and it's important to keep our sense of humor. And you kind of see that. You see all the memes that are going around. You see all the comedy things on like Netflix are very popular right now. But it's important for us to keep using humor. And that's one of the tips I would give is shut off the news at some point during the day and turn on something funny. We don't need to know the latest statistics. It's good to have a broad overview and see if any major developments happen. But day by day, there's no value to looking at how many people died today and what's going on. It is what it is. We can try to de-stress by looking at.
Well, it's interesting, Anil, as well. You said about shutting off the news, and actually that was one of the major points. I interviewed some psychologists yesterday, and we looked at strategies at this time, and one of them was shut off the darn news, you know, make special times for checking in on that, but to turn it off. And this is a great suggestion. Put in a little humor or laughter.
Instead of looking at the news over and over again, connect with your family, play games, charades, Pictionary, anything that gets you to interact and leads to laughter. That's really important right now.
Mm-hmm.
Yeah.
I know you're a fan of Ray Romano.
Right. Yeah, this is an old one of his. This is what kind of launched him. He was a very clean comedian at one time. His recent stuff is a little. I wouldn't recommend watching it with your kids, but the old stuff you can watch with your kids for sure.
Mm-hmm. He always reminded me a little bit of Seinfeld in that sort of clean comedy and more a self-deprecating style rather than being critical of others. Would you agree with that?
I would agree. Yeah, Ray Romano and Jerry Seinfeld are masters of that. Jerry Seinfeld has an excellent special right now on Netflix. If you haven't seen it yet, I would highly recommend it. And it's clean, so you can watch it with your family. Great stuff. Great. Yeah.
There are two quotes here, Anil. One is that laughter is the best medicine in the world, and that's from Milton Berle, and I know you have some comments about that. And the other one is actually from a psychologist at Cleveland Clinic in our mothership in Ohio. He's a psychologist, Scott Bea, and he says humor is a good way to activate good brain chemistry and actually protect ourselves with better immune function. It is really good medicine. And perhaps you could speak to both of those quotes.
Sure. Scott Bea is a good name to have. That's an easy name to remember, thanks to Scott Bea. But let's start with laughter is the best medicine in the world. Well, you know, I love a sense of humor, but let's not get carried away. If you have diabetes, insulin might be the best medicine in the world. If you have a serious bee allergy, an EpiPen might be the best medicine in the world. But laughter is a darn good medicine. Let's leave it at that. I do agree with Scott Baio, or excuse me, Scott Baya. Humor is a good way to protect us, improve our immune function. There's been studies that show that your IgA levels go up after you watch something funny, watch funny videos. And IgA is known to protect against viruses as well as some bacterial infections. So it can't hurt to have higher IgA levels. They haven't proven that it absolutely prevents infections, but they have shown definitively that it increases IgA levels. One of the viruses they study, incidentally, is the coronavirus, because the coronavirus, for those of you that don't know, actually causes most of the colds that are out there. This is just a special variety of the coronavirus that we have going on. So it certainly can help us to boost our immune system right now against viruses.
Mm-hmm. And for instance, SARS was a coronavirus. And in the last couple of talks we did, we talked about COVID-19, which stands for coronavirus disease 2019. In other words, it's one type of coronavirus that we're looking at right now. And the corona means crown. And if you look, you know, in the electron microscopy, which we've talked about in previous talks, it actually looks like a crown on the fine microscopy. So that's how we came up with this corona. So I had to throw that in, a little trivia pursuit.
Yeah, if it didn't make people so darn sick and kill us all, it's actually, I mean, the images are beautiful. It's a beautiful image. It's just unfortunate that it's such a nasty virus.
Yeah.
Yeah.
There are also mental health benefits, certainly, to laughter. It seems intuitive. Laughter, joy, happiness. Perhaps you could speak to that and some of the positive effects of laughter.
Yeah, laughter is, I think, one of the most underappreciated ways of dealing with things like stress, especially. And if you already have depression or anxiety, it tends to help. And there have been lots and lots of studies done that show that people with good senses of humor that really work on their senses of humor tend to be protected somewhat from depression and anxiety. Now, that's not saying you can have a sense of humor and still have depression and anxiety. They are, after all, chemical imbalances. And so it's not your fault that you have it, but you can, it's good to use more humor to help manage it. Just like you would take a medicine to help manage it, or you might do cognitive behavioral therapy, or use any other techniques such as exercise. Humor is just another tool in the toolbox to help manage stress, manage these conditions. It may not do it by itself, but it's sure going to make it more fun.
And I know you also wanted to mention about Dave Barry.
Yeah. Yeah. Oh, and I should mention, it says the positive effects of laughter can last up to 24 hours. It's just like a pill, basically. It wears off. So you need a daily dose of laughter to kind of help increase mood or improve mood.
So I get to call you every day then, do I?
I don't have that many jokes, actually. Dave Barry is one of my favorite humorists. That's somebody you could turn to. He's got a lot of work out there. There's lots of other writers. Carl Hyacin is another one that is just zany humor. But you can easily do a search on different humorous writers out there, and it's a good way to prime the pump, which we'll be talking about in a bit.
So there are known physical health benefits, and I thought we would spend a minute on those. Certainly we were both reading about different health benefits and heart benefits and so forth, and they divided them into short and long-term benefits. So I thought we could kind of quickly go through those as well. In terms of short-term benefits, perhaps you could speak to these.
Well, the last slide we talked about a study done in the University of Maryland, and this was done in the 2000s. Dr. Miller, it got a lot of press because he was able to prove, he put people into two groups. One group watched funny videos, and one group watched more news kind of videos with that might be covering something sad. And he basically was able to show that the people who watched the humorous videos, actually their blood vessels dilated. They had changes, metabolic changes that were very positive, and that would lower your risk for heart disease if these changes were to be maintained. And again, yeah, one bout of laughter for 15 minutes is not going to give you any permanent changes, just like one pill is not going to give you any permanent changes. But if you were to actively use humor every day, you could see benefits. So the short-term benefits, let's talk about those. When you laugh, if you think about it, you're taking in a lot of air, especially a good belly laugh that we all will have with our friends, or with, you know, there's just certain people that make you laugh really hard. For me, one of them is Chris Farley. My wife thinks I'm an idiot when I'm watching Chris Farley. She doesn't get it, but he makes me laugh so hard. I can only take about 5 or 10 minutes of him before my stomach hurts, but he was a very funny man. Our friends make us laugh, but when you laugh, when you have that belly laugh, you're breathing deeply, you're taking in more oxygen, you're exchanging oxygen, and after your muscles tighten up, afterwards they loosen up, so you actually relax. So it helps your muscles relax. And of course, when you're laughing, your heart rate goes up, your blood pressure goes up temporarily. And then right afterwards, just like with exercise, your blood pressure starts to drop. And actually, it's been shown to, if you're exercising on a regular basis, or if you're laughing, let's say on a regular basis, and we're talking about a deep laugh, you're stimulating your circulatory system. And so it leads to a lot of benefits that way, short term.
When I was preparing this talk, I was looking at comedy as well. And since you're mentioning different comedians, I did look at a Robin Williams, Johnny Winters clip on Johnny Carson. And if anyone wants a belly laugh, that was a belly laugh. That was ridiculous. It was so funny. So there's something for the audience to Google. We're also talking about long-term benefits, and maybe you could speak to these as well. You already mentioned about immunity, and interestingly, exercise, moderate level exercise, also improves immunity, and we've given some talks about that as well. And as you say, it's not going to prevent an infection, but perhaps it helps to fight an infection, which is important, obviously, especially during this COVID-19 time.
Yeah.
Maybe you could speak to some of the other things. And I know that Gary Larson is one of your favorite.
Yeah, I've tried to include the
well.
things in the corners of these slides. These are just other resources to kind of, and again, we'll talk about it later, but to prime the pump, No, you're not going to prime a pump. You're going to prime your pump. To get surround yourself with humor so that you're thinking funny. I love Gary Larson, but it's very geeky humor, I must admit. Yeah, so we talked about the immunity. There have been studies that show that laughter increases endorphins, sort of like exercise does, but there have also been other studies that show that it doesn't. So it's a mixed bag. I say, you know, if there's a chance, let's do it. I mean, what's the downside? Laughter is fun. Just don't do it while you're eating or drinking. You may choke, but other than that, it's a fun way of de-stressing. It has been shown to help some people, and some studies have used it to decrease pain levels. And we think it might be in those people, it might be due to endorphins. We're not sure. Norman Cousins made this very popular back in, what was it? I believe the 70s, when he wrote a book, Anatomy of an Illness. And he talked about he had rheumatoid arthritis, and he took it upon himself to watch hours of humor a day, and he felt that it would keep the pain at bay for long periods of time. I see that people are chiming in and mentioning Dilbert and Herman, and yeah, actually those are I like both of those comics as well. Humor definitely makes it easier to cope with difficult situations, such as maybe the one that we're in right now. It's definitely more important than ever to have a sense of humor. Mm-hmm. It improves our connections with others. Like if you're playing games at home, or you're, I used to do a lot of skits when I was growing up, and if you make it like a skit night where everybody has to come up with a funny skit to show to the family, it gets you to be creative, it makes you laugh, it makes you bond. When you have these Zoom calls with good friends, I have tears in my eyes sometimes, my stomach hurts, and it just increases our bond because we can't meet for sure. and improves mood. I mean, I don't know. Would anybody argue with that, that laughter improves your mood? If you're going to argue with that, I'm not sure I want to be your friend.
Yeah. You don't want to be in that argument, no.
Yeah, yeah.
So what are some ways to add humor to your life? You've mentioned a few already, but you know, at this time, it is a difficult time. We're all at home. Although things are starting to open up a bit. We know laughter is good. So what things can we do to add humor?
So I keep talking about priming the pump, or as I said previously, priming the prump. Having things around us, surrounding ourselves with funny things, books, DVDs, CDs. Actually, I'm not sure anybody uses the DVDs and CDs anymore. I had to dig some of mine up. Nowadays, everything's free. You do. Yeah. I mean, do you stream more, or do you use those more, the CDs and DVDs more?
I have a record player.
That's awesome. Well, you know, if you're audiophiles, people who love music swear that records sound the best.
I think so.
I don't have enough of an ear for music to know the difference. But nowadays, everything's streamed, so you have so much funny content online. But sometimes, you know, when you're going to bed, it's nice to read something funny. And it's not a great idea to have a screen right before you go to bed. So having maybe just some comic books like Dilbert or any of these others, or having a funny author like Dave Barry to read is great. So keeping that pump primed is important. And then asking yourself, and as we go down this list, I'm going to go from more passive to more active forms of humor. And so ask yourself, where's the funny? There used to be an 80s commercial. I don't know how many people on this call are old enough to remember this commercial, but it was a Wendy's commercial. And I think the actress's name was Claire something. She would go to burger joints and pick up the top and say, "Where's the beef?" And it went on for quite a while, and I still find that commercial funny. But I think we have to ask ourselves, where's the funny? Where's the funny all the time? Sometimes we have to force ourselves to look at it, because in stressful situations, that's the last thing you want to be doing, is asking yourself, where's the funny? But sometimes, you know, we tend to do better when we're not stressed. So if there's something that can diffuse the situation a little bit, if you keep asking yourself, where's the funny, and you make it a habit. And I have to admit, and my wife will be the first to tell you, I don't do it 100% of the time. She's actually better at it than I am. But I have to remind myself to look at where's the funny. And I think that's really important. The other thing you could do is write something, anything. You and I talked about this, and you mentioned that the New Yorker has a contest, a cartoon captioning contest online, where they give you the cartoon and you come up with the caption. They pick the best caption, and then you win a prize. That's a great way of kind of stoking the comedy fires, or the humor, getting your humor levels up. So you can just writing captions, and you know, professional writers probably write 100 captions, and then pick their 10 best, and then gradually get down to one, and that one is really funny. So it's a good way of practicing humor. Writing
now, while you were in residency, I know it was a tough time.
Right.
Medical residency in New Jersey. It's a 3-year rigorous program that you were in. And when we were discussing this, you mentioned that you didn't have any time for anything really, but you did write a script. And
I dug it up, and I didn't have time to go to the stand-up comedy clubs, especially when I was doing the inpatient medicine. You're working crazy hours, you're incredibly stressed. So to de-stress, I actually, I had only told my wife about this previously, but I had actually written a script, and it's in a binder, and you can see it here. It says Med Loans. This is my medical school loan binder, which I got rid of all those papers. And used, I was at the Mountainside Hospital back then, and you can see I used the paper from Mountainside Hospital. So when I was on call and waiting for the action, which wasn't very often, it was usually pretty high action, if I wasn't able to sleep right away, I would work on this script. And I don't know how many pages it is, but I ended up finishing the script. Haven't shown it to anybody. I don't think anybody would purchase it or anything, but it still makes me laugh. And so, it was just a creative outlet, good way to have fun. So I would recommend, you don't have to write a script, obviously, but you could cartoon captioning, write some jokes, see how they go, try them out on your family. They're trapped in the house with you anyway, so you might as well.
And you've also done some stand-up comedy classes, which I didn't realize they had here at Second City in Toronto here. And tell us a little more about that and other options there.
Yeah, so when I was doing comedy in New York, when I was in New Jersey, I used to schlep into New York City, and I took because I didn't have the time to do a lot of comedy, and really you have to do a lot of anything to get better. I took some comedy courses to help, and then years later, when I moved here to Toronto, I hadn't done comedy in a long time, and I was getting the itch to do it again. But I felt a little rusty, so I took a little refresher course at Second City, actually. They and got to perform last year before the coronavirus. But they still have courses. They have online courses. They have stand-up. They have improv. Improv is a great way to go if you don't want to do stand-up comedy. It is, if you've ever been interested in laughing more or learning how to create humor, that's a great way to go.
So for all the wannabe comedians out there, that's a good little tip.
Yeah, and I know that there are professionals that go to organizations that and lead these kind of improv sessions with employees of corporations to kind of help break the ice and help people get a sense of humor and have fun together. Yeah, so I would highly recommend it.
Good. So these are some interesting posters that you're going to speak to in a second. But my question is, how do you use laughter in healthcare settings? Right. And I know it's a delicate, sensitive topic, very difficult to do appropriately. And perhaps we could start off with some do's and don'ts if there's, audience members that want to use comedy, either if they're a physician and they're using it with their patients, or in other work type situations. What are some do's and don'ts? And then maybe we can get into some examples of how you would use comedy.
Right. Yeah, so this is really important. Obviously, we're in a field in healthcare, we're in a field which is, as you said, it can be delicate. So you have to be careful with humor. You can't always use it in your workplace or in healthcare or even with your family or friends. You have to choose wisely. So especially in healthcare, it may not always be appropriate. I tend to use it more in my practice in Cambridge because I take care of those patients. I've been taking care of them for 11 years now. And so they know me, and the ones that I feel comfortable with, I use more humor with. Whereas when I do the executive health work here at the Cleveland Clinic, oftentimes it's the first time I'm meeting someone. And so it's not an appropriate time to use humor. Now, there are the rare exceptions where you hit it off with that person and you have to feel out the situation. But there are certain people that are, you can do it with, but I would not recommend as a general habit, trying to use a sense of humor with everybody all the time. You don't want to come in like a buzzsaw. You want to dip your toes in the water, if anything. The best quote I might have heard about it is, you want to establish your competence first and then let your humor emerge. If you go the other way, it might not work out so well. And then pay attention to the response. If you try something small, if it's not getting a response, then probably not a good idea. Also be aware of your surroundings, and obviously it's not always appropriate with the patient. They may have things going on in their life that are serious, and humor is not going to be the right thing here. And other times they may be okay with it, but then you have to be careful about if there's somebody else in the room that's going through something. a spouse or a family member, or if you're in a public area, if the door's not closed, especially in a healthcare facility or even in an office, I suppose, there might be people next door that will overhear you, and it might not be appropriate for them. So you have to be careful with things like that. You certainly, you want to avoid certain kinds of humor for sure. We talked about self-deprecating humor before. That's probably your safest bet. And we'll talk a little bit more about that in a sec. But you don't want to make fun of anybody else, of course. You don't want to make fun of patients or groups of patients or groups of people or anything like that. You want to stay away from that. It just doesn't come off right. You want to avoid dark humor. Sarcasm's probably not a great idea. Political and religious humor, probably not a great idea. You want to stay with the safer, lighter stuff, and really experiment. And if it's with very small steps.
When we spoke,
but like I said,
when we spoke earlier, Anil, you also mentioned that you may have something that you've thought of saying, but if in doubt, leave it out.
Yeah, always.
In terms of,
yes, if you have any nagging doubt, don't use it. That's your inner system telling you something's not right. So you definitely want to do that. For example, these are actually examples I have up in my office in Cambridge. I would not put them up in the Cleveland Clinic because, like I said, some people don't know me yet. In my other office, they know me, and they know I talk about exercise all the time as a great way to prevent disease. And so these posters, these are me, by the way. If you were wondering, the middle one, definitely you could tell. But the side ones, to me, the humorous part is the first time when I first put these up and my patients saw them for the first time, they would look at the poster, they would look at me, they would look at the poster, they would look at me. And I could tell they were struggling with, is this him? And should I bring it up or not? And so I would bring it up myself. Yes, that is me. That's a Movember mustache I grew about 10 years ago when I didn't have any salt and pepper hair in my mustache. Now it would be totally different. But it's just to bring up to remind people about exercise. People have a good chuckle over it, and then it leads us into the discussion about are you exercising and bringing it back up, reminding them basically. And then on Instagram and social media and all that, at the holidays, I usually send out the one in the middle, which gets a few chuckles and again reminds everybody that humor is important. But then there's other things that I will sometimes very selectively use, even more out there than this. I won't use it on everybody, but patients that I know really well and that I know have a great sense of humor, I will, there's a bit I have that I do on stage about the rectal exam, which, in men, we're checking the prostate. And, I would say, why is it that everybody feels sorry for the patient? What about the doctor? It's not like we're sitting in our offices going, oh, goody, another rectal exam, bring him in, bring him in. As far as I'm concerned, it's much better to have a finger on your prostate than a prostate on your finger. But so that goes well in the stand-up comedy clubs. Probably wouldn't go really well with the first-time patient, or quite frankly, a lot of patients. But so you have to be very selective in your humor. That is something I would only do with people I know well and a bunch of strangers on this call. No, I'm kidding. We know most.
Great, there you go. Now, we can certainly use humor to cope, to help us cope and deal with stress. And I know that everything isn't hee hee ha ha, like your father said to you many years ago. I know that things have not always gone smoothly for you and for your family. I did read a lot about you before this interview today, as you know, and I have your permission and your wife's permission to talk about this. But I know that 17 years ago, your lovely wife, Pretty, was diagnosed with breast cancer at age 31.
Yeah.
Devastating for both of you. And I know that we've talked about this, and you described some ways how humor at different times through that ordeal was really helpful. And I hoped that you would share it with the audience today.
Yeah, yeah, that was a particularly dark moment in our lives. And luckily, let's start off with, first of all, she's okay. It's 17 years later. She went through a lot of treatment. Everything's fine. It hasn't come back. That's great. But at the time, it was one of the most stressful things we had ever been through. It was incredibly stressful, and I had read about how even in the cancer wards, and when people are at their darkest moments, the sense of humor does come out, and that's what happened with us. She was going through chemotherapy, and of course, with chemotherapy, your hair starts to fall out, or specifically her kind of the chemotherapy drugs that were being used. Her hair did start falling out, and they had warned us ahead of time, and they said, you might consider cutting off your hair, shaving your head, and she had no interest in that, and of course, who does? But when it starts falling out in clumps, then you realize, yeah, I better do something. This is just not. This is not good. So we cut it all off, and we buzz cut, and we did a buzz cut. But then there were the short little hairs left, and over time they were falling all over the place, all over the house, all over the pillows, all over everything. And she didn't want to shave her head, so I got this brilliant idea of using those lint brushes, the sticky ones, the rollers. So I'm rolling this all over her head, and we were laughing hysterically. I mean, any other situation that would not be funny, but because you're under so much stress, and it's a moment that we shared together that we still talk about to this day. Remember when I used that roller on your head? And she said, "Yeah, don't ever do that again." But it's just one of those things. I think that the human psyche craves stress relief, and humor works perfectly for it sometimes.
Mm-hmm.
Yeah.
Well, thank you for sharing that story. And, one of the great things for me during COVID, or one of the positive things that's come out of COVID for me, is being able to do this series and connect with people at a more meaningful level. Colleagues that I don't, you work on a different day than I do at the clinic. And so it's really a treat for me to hear people's stories and to have that connection. So thanks so much. And thanks to Pretty, who I think is in the audience as well. So thank you very much. Also, you've shared, we're slowly running out of time here. I think we have another 3 minutes. I wanted you to, you kindly sent in these different organizations and information on where to learn more about humor. And I know you were particularly keen on Paul McGee, and maybe you could speak to that for the audience participants today.
Yeah. So you would be amazed with how much research is being done on humor and laughter as therapy for mental health, physical health. And I think one of the most amazing people in this field is Paul McGee, who's a psychologist with a PhD that's been talking about this for at least 30 years, probably closer to 40 years. I had his book from 1999, I believe. It's right here next to me. This was his first book, but then since then he's written these 2 other books that you see on the screen here. One is the one on the left in the green, The Lighter Path to Resilience in Health, goes into all the studies and in great detail. It's available on Kindle for like nothing. It's like $4 or something like that. And the one on the right, he actually runs a course that he takes to corporations and organizations. And but you can certainly learn how to become more humorous the way he's written it out there. A great resource. Other things that he's pointed out are these organizations. You wouldn't know about all these organizations that are out there nationally and internationally on humor studies, basically. And you've got a European one on this list, you've got an Israeli one on this list, and then a couple of American ones. Fantastic resources if you're interested, for sure.
Great. And I think we have like 2 minutes left, and we have one question here, which is harder, stand-up comedy or medicine?
That's a great one. They're both very, very hard in their own ways. medicine is very structured, and if you do this, you'll get to this, and so on. Whereas stand-up comedy it's very hard. There's a million people trying to do it, and to get up the pyramid, it takes a lot of work. In many ways, I think stand-up comedy is actually harder. I have a lot of respect for the people that do it extremely well, like Jerry Seinfeld, Jim Gaffigan, who I respect a lot. And these are both, by the way, very clean comedians that you can watch with your families. It's very difficult. You don't realize how much work goes into, you might write 100 lines to get one funny line out of there. And then, stringing it all together. And we've talked about performing versus writing. What's more important? They're both equally important. So you got to get stage time. I could certainly use more stage time. This darn career in medicine gets in the way, but yeah, I would say stand-up comedy is harder for me anyway.
Well, you'll have to let us know your next gig, and maybe at Second City or something, and we'll all go down and cheer you on. I just wanted to say thank you so much. Next week, we are going to be doing a webinar on leadership, and our CEO, Mike Kessel, is going to be on, along with Megan Guest, who is one of our VPs. So until then, thank you all out there for joining us. And
yes, thank you.
If you have any questions or need further information, here are some other websites there. So thanks very much. And thanks so much, Anil and Kriti, who is out there as well. So
Thanks for having me on, Cathy. Thank
Great.
you, everybody, for listening.